A trade union is calling for NHS Grampian to put plans for 30-minute ambulance drop-off times on hold. The changes are designed to prevent ambulances from stacking up outside hospitals. But a health union is warning some patients will now be treated in corridors while waiting to be admitted. Here's Kirstin Tait.
Every winter, pressure inevitably mounts up on the NHS. Earlier this month, 17 ambulances were forced to wait outside A&E in Aberdeen. NHS Grampian have now enforced plans to unload patients within 30 minutes to prevent vehicles stacking up, something trade union UNISON say should be put on hold until it can be made safe.
Patients are going to be left in the corridor outside of wards, and staff are just not sure that's going to be safe. If you think about how they're going to contact staff, patients are actually being given little handbells to ring to try and get staff's attention. So there's going to be nurses who are already run off their feet, who are at the other end of the ward, who can't even see these patients. And then from the corridor, there's going to be a little ring of a bell, and the hope the staff will be able to A, hear that, and B, be able to come.
It's hoped the project will allow paramedics to get back on the road to attend to more patients.
I think realistically, the reasons for frustration from the ambulance service are crews that are having to wait when they should be out on the road, wait outside accident emergency when they should be out on the road, caring for other patients. So we really welcome initiatives to reduce that length of time that ambulances are stacking outside.
Last week, the Deputy First Minister apologised after 700 ambulances were waiting outside hospitals across the country. On one occasion, an ambulance was waiting outside in Grampian for 12 hours. But the Scottish Government say they're working hard to address the issues.
We've had lots of pressure right across our system. We've had a very busy hospital for particularly the past year. There's hardly been any respite from that. What that's meant is that we've had a higher volume of patients in, they've been sicker, and therefore our hospital has remained full. What that's meant is that our ambulances have been required, when they've brought patients to the front door, we've been unable to get them in. So what this plan is to help that equalise across the system.
The Health Board says staff mental health is a priority.
It's really important our staff have a consistent approach to how we look after them. We know if we look after our staff, they look after our patients, so that's really, really important to us. We have a range of services in place, from formal services to look after our teams in terms of psychological support, health and well-being.
NHS Grampian say 18 new beds are now available at ARI, with a further 18 expected in the new year. But bosses say there continues to be strain on their resources. Kirstin Tait, STV News.